What if your body's engine started running too fast, burning fuel at an alarming rate, leaving you tired, anxious, and restless? This is the reality for people living with hyperthyroidism, a condition where the thyroid gland produces too much hormone, accelerating the body's metabolism. Often subtle at first, the symptoms can be mistaken for stress, aging, or mood disorders. Yet left untreated, hyperthyroidism can have serious consequences for the heart, bones, and overall well-being. In this video, we'll explore what causes hyperthyroidism, who is most at risk, how it presents, and the treatments that can help restore balance to the body's vital systems. Hyperthyroidism, most common in adults aged 20 to 50 and far more prevalent in women, occurs when the thyroid produces excess hormones, speeding up the body's metabolism. Risk factors include a family history of thyroid disease, particularly Graves' disease, a personal history of certain chronic illnesses, such as pernicious anemia and primary adrenal insufficiency, and recent pregnancy. The most common cause of hyperthyroidism is Graves' disease, which occurs when the body produces antibodies that stimulate the excessive production of thyroid hormones. Other, less common causes include one or more thyroid nodules that overproduce hormones, inflammation of the thyroid gland, known as thyroiditis, and the use of certain medications. Thyroiditis can result from an autoimmune disorder, or in some cases, the exact cause may be unclear. Inflammation of the thyroid can cause stored hormones to leak into the bloodstream. When a single nodule produces excess thyroid hormones, it is called a toxic adenoma. If multiple nodules are involved, the condition is referred to as multinodular toxic goiter. An adenoma is a section of the gland that is isolated from the rest, forming non-cancerous lumps that can lead to an enlarged thyroid. Individuals with hyperthyroidism may experience symptoms that do not immediately suggest thyroid issues. Common symptoms include increased fatigue, an intolerance to heat, unexplained weight loss despite increased appetite, heart palpitations, and shortness of breath. They may also have an accelerated heart rate, mood disorders, feelings of nervousness, and sleep disturbances. In elderly patients, symptoms can mimic depression or dementia. Women may experience irregular menstrual cycles, with periods that are more frequent and scanty, while both men and women can experience a decreased libido. Depending on the underlying cause, the thyroid gland may feel enlarged, tender, or entirely painless. And, in some, nodules may be detectable. Other physical signs may include warm, moist skin, thinning hair, and increased hair loss, which can occur in patches. Some may notice more frequent bowel movements or even diarrhea. A fine tremor in the finger is also common, typically noticeable when the patient extends their arms and fingers. Some individuals with hyperthyroidism may experience a thyroid eye disease, a condition known as Graves' ophthalmopathy, which is more prevalent among smokers. This disorder impacts the muscles and other tissues surrounding the eyes. Symptoms may include bulging eyes, a gritty sensation, pressure or pain in the eyes, puffy or retracted eyelids, reddened or inflamed eyes, light sensitivity, and double vision. If left untreated, these eye problems can lead to vision loss. Untreated disease can result in weak and brittle bones, a condition known as osteoporosis. Bone strength is partly determined by the levels of calcium and other minerals they contain. Excess thyroid hormone makes it difficult for the body to absorb calcium into the bones. Hyperthyroidism can lead to serious heart complications such as heart rhythm disorder, which raises the risk of stroke. Another concern is congestive heart failure, a condition in which the heart is unable to circulate enough blood to meet the body's needs. In severe cases, hyperthyroidism can lead to thyrotoxic crisis, an emergency characterized by elevated body temperature, high blood pressure, rapid heartbeat, arrhythmias, nausea and vomiting, diarrhea, and altered consciousness. To diagnose hyperthyroidism, a doctor, typically an endocrinologist, will take the patient's medical history, palpate the thyroid gland, and conduct laboratory tests to measure thyroid hormone levels. A thyroid ultrasound may also be performed if deemed necessary. Typically, a physician will evaluate the patient for symptoms, associated conditions, and current medication. So, it is important for patients to have a list of their medications on hand. It is advisable to bring the medicine containers to the appointment. In some cases, imaging of the thyroid gland using radioactive preparations or scintigraphy may be required. If nodules are found, a fine needle aspiration may be performed to assess whether any nodules are malignant. Treatment for hyperthyroidism varies depending on the underlying cause. Common approaches include medications to regulate heart rhythm and drugs that reduce thyroid gland function. In specific cases, radioactive iodine therapy may be utilized to diminish the size and function of the thyroid gland. Surgical removal of part or all of the thyroid gland may be necessary to permanently resolve the issues. Though patients who undergo complete removal will require lifelong thyroid hormone replacement therapy. Graves' ophthalmopathy often does not require treatment, as it typically resolves on its own. However, patients are advised to stop smoking to help mitigate symptoms. With appropriate treatment and adherence to medical advice, patients can manage their condition effectively and lead normal lives. Hyperthyroidism is a complex but manageable condition. With early recognition and proper treatment, most patients can regain control over their symptoms and maintain a healthy, active life. Whether caused by Graves' disease, thyroid nodules, or inflammation, identifying the root of the problem is key to choosing the right therapy, be it medication, radioactive iodine, or surgery. Regular medical follow-ups, attention to changes in your body, and the lifestyle adjustments, like quitting smoking, can make a significant difference. The thyroid may be small, but its impact is powerful, and with the right care, so are you. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.